12-lead EKG placement presented by EmergiCare when your health is on the line. 12-lead EKG placement consists of having limb leads, which be right arm, right leg, and left leg, and precordial leads, V1 through V6. Limb leads. They are used for basic ECG monitoring. They should not be placed directly over the bony part of the skin. If possible, should not be placed on the stomach. This would cause artifact from the belly breathing. Here is a diagram of where to place your limb leads on your patient. Precordial leads. First, place V1 in the fourth intercostal space to the right of the sternum. Then, place V2, also in the fourth intercostal space, but to the left of the sternum. From there, you should now place V4. This will be in the fifth intercostal space at the midclavicular line. Now, place V3 directly between V2 and V4. Now place V6 in the fifth intercostal space at the mid-axillary line, which is directly under the midpoint of the armpit. Go back and place V5, which is level with V4, between V4 and V6. Here's a diagram. First place V1, then place V2. Now you want to jump to V4 in the midclavicular line. After placing V4, place V3 in between V2 and V4. Then place V6 in the mid-axillary line at the fifth intercostal space, and then place V5 in between V4 and V6. Troubleshooting. If patient is diaphoretic, be sure to dry the patient's skin with a towel and maybe use an alcohol prep before attempting the lead placement. Don't forget to connect the precordial lead cable into the main limb lead cable. You may get a wavy reading if the patient is using accessory muscles to breathe and your leads are placed on the patient's belly. You could get artifact if the leads are coiled up and resting or setting on the patient's lap or stomach. If you have any questions, comments, or concerns, please see any operations or field supervisor or any field training officer. Thank you for your time and cooperation. Again, this is a presentation of EmergiCare when your health is on the line. Thank you.